Have you ever experienced muscle stiffness that just won't go away? What if it's not just stress or fatigue, but something more serious? Stiff person syndrome, SPS, is a rare but often misunderstood condition that can really affect a person's life if left undiagnosed. You see, the early signs might be easy to brush off, but ignoring them could lead to more severe, life-threatening symptoms. And that's exactly why you need to watch every second of this video. In this video, we'll explain everything you need to know about SPS, from the early symptoms to what causes it. And don't worry, we'll also provide some treatment options, so stay with us until the end to find out. Ready? Let's dive in. First, let's talk about SPS. Stiff person syndrome, SPS, is a rare neurological condition that affects how the muscles function. Imagine feeling your muscles are constantly tight and rigid, and then suddenly they spasm and hurt. That's what living with SPS can be like. Although it's quite rare, affecting about 1 or 2 people out of a million. For instance, in the United States, there are fewer than 5,000 reported cases as of 2023. However, there has been a recent surge in cases worldwide. That's why recognizing the early symptoms can be so important. Let's discuss the symptoms of SPS to help you understand this condition better. So, what are the symptoms? If you're wondering about the symptoms of SPS, it's helpful to think of them in 2 main categories: muscle stiffness and muscle spasms. 1. Muscle stiffness. Muscle stiffness is a condition where your muscles feel tight and inflexible. Picture this: your muscles feeling as if they're constantly in a state of tension, almost like they're stuck in a tight, invisible brace. That's what muscle stiffness in SPS feels like. It usually starts in the muscles of your torso, your chest, back, and abdomen, and can spread to your arms and legs. This stiffness can be really uncomfortable and can limit your ability to move freely. Over time, it might even cause you to adopt a hunched posture, making everyday activities like walking or sitting quite difficult. 2. Muscle spasms. Alongside the stiffness, you might experience sudden, intense muscle spasms. These are like sudden cramps that can last from a few seconds to several minutes. For some people, these spasms are strong enough to cause falls or abrupt jerks. The spasms can be triggered by different things like sudden movements and loud noises. Even something unexpected, like emotional stress, can set them off. Because they're so unpredictable, they can make daily life feel quite challenging. 3. Emotional symptoms. SPS doesn't only affect your muscles, it can also tamper with your mental health. Many people with SPS deal with anxiety, depression, or specific fears. For instance, the fear of experiencing a spasm in public can make you hesitant to leave your home or even be in crowded spaces. So managing these emotional effects is just as important as handling the physical symptoms. But what causes SPS? The exact cause of SPS isn't completely understood, but it's known to be an autoimmune disorder. Here's how best to describe an autoimmune disorder. In autoimmune conditions, your immune system mistakenly attacks your own body, treating its own cells as if they were foreign invaders. For SPS, it targets a protein called glutamic acid decarboxylase, GAD. GAD is crucial for producing a neurotransmitter called gamma-aminobutyric acid, GABA. GABA helps to control muscle movement by decreasing the activity of motor neurons, and this makes it very essential for the nervous system. When GAD is attacked, less GABA is produced, and motor neurons become overactive. This leads to muscle stiffness and spasms experienced in SPS. However, not everyone with SPS has the antibodies that attack GAD, and some people with these antibodies don't develop SPS. But in about 60 to 80% of SPS cases, these antibodies are present, suggesting they might play a role in causing the condition. Here are some other factors that can increase your risk of developing SPS. Gender. SPS affects women twice as often as men. Age. Symptoms usually begin between ages 30 and 40. Autoimmune conditions, commonly associated with other autoimmune disorders like celiac disease and type 1 diabetes. Cancer, more prevalent in people with cancers such as lung, breast, and lymphoma. Enjoying the video? Show your support by smashing the like button, dropping a comment, and subscribing to the channel to become part of our growing community and never miss a new upload. Now let's discuss what triggers SPS. Living with SPS often means figuring out what sets off your symptoms. Here are some common triggers. 1. Sudden movements. Quick or unexpected movements can be a real challenge. If you stand up too fast or make a sudden turn, it might trigger a muscle spasm, making everyday activities feel difficult. 2. Light. Bright lights or sudden changes in lighting can be tough to deal with. Your body might react with increased tension or even spasms, so places with changing lights can be tricky. 3. Loud or unexpected noises. Noises like a sudden bang or a loud car horn can catch you off guard and cause a spasm. For those with SPS, noisy environments can be a lot to handle because these sounds can trigger muscle contractions. 4. Physical touch or stimulation. Even a light touch can sometimes be uncomfortable. What feels gentle to others might set off a spasm for you, making physical contact something you have to be careful with. 5. Emotional stress. Stress and anxiety can really trigger your symptoms. When you're feeling stressed, your muscles might tighten up even more, so finding ways to relax like deep breathing can be really helpful. 6. Temperature changes. Moving between hot and cold environments can also set off symptoms, so it's important to pay attention to temperature changes and try to avoid extremes when possible. What are the different types of SPS? SPS isn't just one thing, it actually comes in different forms. Let's discuss them. 1. Classic stiff person syndrome. This is the most common type. It usually causes stiffness in your torso, but it can affect your whole body, making movement pretty challenging. 2. Focal stiff person syndrome. This form is a bit different because it only affects specific parts of your body, like your arms or legs. 3. Jerking stiff person syndrome. Along with muscle stiffness, this type also brings sudden jerking movements. 4. Progressive encephalomyelitis with rigidity and myoclonus, PERM. PERM is a more serious type with widespread muscle stiffness, quick jerks, and even brain inflammation. 5. Paraneoplastic stiff person syndrome. This type is linked to certain cancers. The good news is that treating the cancer might also help ease the SPS symptoms, so it's important to tackle both. So what treatments are available for SPS? There's no cure for SPS yet, but there are several treatments that can help manage the symptoms. Here's what you might consider. 1. Medications. Benzodiazepines like diazepam and clonazepam can relax your muscles and reduce spasms, making movement a bit easier. Muscle relaxants like baclofen often work well with benzodiazepines to ease stiffness, helping you feel a bit more flexible. Anti-seizure drugs such as gabapentin and pregabalin can help control spasms, offering some relief from those nerve-related symptoms. 2. Immunomodulating therapies. Plasmapheresis, which removes harmful antibodies, can improve symptoms by changing how your immune system reacts. Intravenous immunoglobulin, IVIG, can also adjust immune system responses, helping to reduce spasms and stiffness. 3. Non-medical interventions. Physical therapy and stretching exercises, like yoga, can help keep your muscles flexible and strong. This helps to prevent stiffness from getting worse. Occupational therapy can teach you new ways to handle daily tasks and manage your condition, especially when your movement is limited. Aquatherapy involves gentle exercises in water. This can reduce muscle stiffness because the water supports your body, making movements smoother and easier. Heat therapy, massage, and acupuncture can also provide temporary relief from stiffness and pain, helping you feel more comfortable. And that concludes what we have for you today. We understand that living with SPS can be challenging, but early detection, avoiding triggers, and proper treatment can greatly help. Thank you for watching. Make sure to leave a thumbs up and subscribe to the channel. Also, check these videos out.